Hello, everyone. It's Friday, November the 6th. Very regretfully, again, I have to tell you we've lost another 15 West Virginians since Wednesday. We're up to 487 deaths in West Virginia now. Our 473rd death is a 91-year-old female from Wetzel County. Our 474th death is an 86-year-old male from Cabell County. Our 475th death is an 81-year-old female from Cabell County. Our 476th death is an 89-year-old female from Mercer County. Our 477th death is a 67-year-old male from Mercer County. Our 478th death is a 71-year-old female from Mercer County. Our 479th death, an 82-year-old male from Putnam County. Our 480th death, a 90-year-old female from Summers County. Our 481st death, a 77-year-old male from Greenbrier County. Our 482nd death, a 73-year-old female from Cabell County. Our 483rd death, a 66-year-old female from Kanawha County. Our 484th death, an 85-year-old male from Wood County. Our 485th death, a 72-year-old female from Fayette County. Our 486th death, an 82-year-old male from Putnam County. And our 487th death, a 77-year-old male from Jefferson County. I'll get into a little bit more just as we go forward here, but we've had 540 new positive cases in the last 24 hours. That's an all-time record for us. Our daily positivity rate is at 4.48. Our cumulative rate is now above 3% at 3.01. We have 6,135 active cases and 20,465 recovered. We've jumped from 264, I believe, to 280 patients that are now hospitalized. Yesterday, we tested 9,916 West Virginians. Probably of everything I can report to you, that's the only thing that I know that is good, is we've tested a lot of people, but we need to continue to move that number up. Our RT effective reproduction number is at 1.13. Significantly above 1%. We want it under 1%. We are right in the middle in the country now. We're the 26th best in the country. We have 3 counties that are now in the red. That's Marshall, Mineral, and Mingo counties. We have 9 counties in the orange. That's Ohio, Berkeley, Hampshire, Tyler, Wood, Jackson, Putnam, Lincoln, and Wyoming counties. Yesterday, in the United States, we had 121,000 people that tested positive for COVID. Do you remember a week or 10 days ago when we were saying that we had tested 60,000 in the United States in a day that were positive for COVID? 60,000, and we thought it was a number that was just off the chart. And then all of a sudden it went to 80,000. And we're talking about in 10 days ago or a week ago Yesterday, we're 121,000 across this country. You know, let me say this. There's lots of requests. There's lots of people that can't understand why, or why me, or it's just the kids, or whatever it may be. I'm one of them. You know, I'm a coach, and I sympathize wholeheartedly with our ball teams and the effort that our athletes make, and I understand it. I told you over and over about the state tournament when we pulled the plug with my team. But absolutely, we have got to understand just this, that we're dealing with tough stuff. I know that there's kids that are innocent as they can possibly be. You know, I know how stressed we are from our testing of our National Guard to our health departments. I know where we are, you know, with people calling the SSAC, wanting to play ball, wanting to cheerlead, whatever it may be. I get every bit of that. So let me tell you what I've done. In all that effort and everything, on Thursday, I called Clayton Birch, you know, who's the head of all of our Department of Ed. And I said, Clayton, I want you to circle back up with the health experts. I want you to circle back up with Dr. Marsh and Dr. Amjad and the DHHR head, you know, Secretary Crouch. I want you to circle back with the head of the SSAC. And then I want y'all to all look at this independent of me, but knowing that we have teams and we have kids and we're in the middle of playoffs and everything else under the sun. And I want you to come back to me with a recommendation that is your recommendation, because really and truly, from my point of view, I want to first and foremost do and listen to those experts. I don't want someone calling our office and me saying, well, this person said, or this person said. I don't want somebody calling the SSAC and them saying, well, the governor said. I don't want somebody calling the Department of Ed and them saying, the SSAC said. I want us to make the very best decision for the people of this great state, and knowing that these decisions are dog flat tough. At the end of the day, and I can cut through all this stuff and everything, but and I know this is really not what our kids that are on specific teams want to hear. But they said, based on the recommendation of the health professionals, the WVSSAC Executive Director, Bernie Dolan, the Superintendent of Schools, Clayton Birch, you know, that we and all of the others that are involved from our DHHR on down, that they feel like that they have to continue using the existing education map and DHHR County Alert System map to guide us through the decisions on these counties. And they say they are very well aware that these are tremendously difficult decisions, and they absolutely are decisions that have to be made. Now let me tell you just this, people. When you look right here and you see 540 new cases in 24 hours, when you look and see our cumulative rate now above 3%, our nation with 121 plus thousand positive cases in a day, when you absolutely, if you're fair, and whether it be Mingo County or Ohio County or Raleigh County or Summers County or whatever the county may be, I have pleaded with people over and over and over to be tested. And at the end of the day, when you are pleading and you've got people there ready to test and 19 show up or 38 show up, that's just not going to cut it. Now, that's all there is to it. Now, anybody in the world could get upset with me, but I'm telling you, when I tell you we need to test and we're going to pay for it and it costs nothing to do and it's absolutely as painless as it can be, and it will help us in every way. It will help your schools. It will help your kids. It will help every way in the world, and you don't show up. It's tough to look back at these health officials or the SSAC or all the people that are in the DHHR or even me and say, well, we ought to come up with another way or this or that, or we ought to be able to test our kids and everything else. And I am telling you, it is an absolute lot of balls to juggle from the standpoint of all the stuff that our National Guard and all these people are doing. We have a real problem right now within this state. And we have a bigger problem that is within this nation. And if we don't watch out, when I come in and I am reading 15 names, it's no fun, first and foremost. And I hate it like crazy for these people and all their loved ones and all their families. It just makes me sick. And I hate it for our kids. I hate it every way for our kids. Because when I talked to Clayton Birch, I said, Clayton, if there's any way that we can come up with a solution here, come up with a solution. Absolutely vet it in every way. And you've heard the solution. The solution is we've got to stay the course. Sad. It's really sad. And so for those kids out there, I hate it. I hate it really, really bad. But at the same time, I don't know what else we can do right now. We have a much, much, much bigger problem than playing sports. And we absolutely want to first and foremost be in school. And we absolutely, if we know, if we'll just jam ourselves back in school in an orange or red county, we could even end up with a colossal problem. And we've got to protect our kids, and we've got to protect our teachers and our service personnel as well. You know, it is a real serious problem. So especially for those athletes and the kids, I hate it, and I hate it like crazy for any of them. For one team to miss, I hate it, and it makes me sick. But at the same time, I don't know what else we can do right now. Okay, there's no point in me going back through this, but encouraging people to get out and test. You know, you hate to say it, but it's just an absolute fact. And that is just this, is if I sit here day after day after day after day, all the medical and all the educational experts and all the National Guard say, go get tested, go get tested, go get tested. And we show up like a sprinkle, and then all of a sudden we end up with the county upside down. And I know that if we would have just gone tested, we wouldn't have had the county upside down maybe. And then we end up with them upside down, and then we start calling and complaining, and we didn't show up. You got to show up, West Virginia, and get tested. You have to. There's no point in me going back through the free testing and the drive-through testing. You've heard that 1,000 times. We have 19 outbreaks now and 93 confirmed cases in our public schools and everything. Those numbers are really not bad, but we don't want any. We have 59 outbreaks in our long-term care facilities. Our outbreaks in our public schools have gone up, and if you just look at on a percentage basis, they've gone up from, I don't recall exactly the number, but even if we were at 80 and we went to 93, That's about a 12% increase, you know, or a 14% increase. You know, it's going up. In our churches, we now have 17 outbreaks in 12 counties. That's Cabell, Doddridge, Kanawha, Lewis, Mingo, Monroe, Raleigh, Ritchie, Tyler, Wayne, Wetzel, and Wood counties. I've told you 1,000 times about going to church and all the social distancing and pews in between. You got to do everything we possibly can do. In our corrections, now we've picked up 2 positive inmates. They're both at Martinsburg Correctional. And, you know, we've got 34 staff cases now. That's a giant jump. You know, I think we were at 10 or something like that on Monday or Wednesday. Now we've gone up to 34, and we'll continue to randomly test 10% of the staff each and every day. And corrections is also coordinating contact tracing with the DHHR and the local health departments. Get your flu shots. The flu vaccines are available. The monies that have gone to the cities and the counties now are $170 million, or these are awarded dollars too, $170,379,000, and we continue to ask you to continue to apply, and we'll continue to pump that money out. Same way on our CARES money that have gone for people, you know, with delinquent utility bills and everything from March 1st to July 31st. You know, we're still, you know, getting those in and getting them processed and everything. And so please continue to do that. And from the standpoint of anything else, that's all I've got right now. It's our nation is experiencing a significant uptick. We're part of our nation, and we're the most vulnerable state of them all, the oldest, the most chronically ill. We do not have an ocean around us that protects us. We are bordered all the way around. 2/3 of the population of the country is within a rock's throw of West Virginia. You know, we absolutely have told everybody, there's no point in me being asked this question from the media. We have told everyone that we absolutely will keep everything on the table as far as potential shutdowns or whatever it may be. Any and everything we will do, and we will do it upon the guidance of the health community and the health experts, as well as the education communities about schools. And absolutely, we will stay on top of this with all in us to the very, very best of our ability. We are working upon another first in the nation potential way to try to do something additional with our nursing homes and the deaths there, because we just look. I mean, it takes no rocket scientist to be able to just figure out when you go through, and hold on just one second, let me make sure, but go through all these deaths. We've got a 91-year-old, we've got a 90-year-old, we have 2 people in the 60s, a 66-year-old and a 67-year-old. Everybody else we're losing, everybody is 70 and 80 years old and 90 years old. Absolutely, this disease nails our elderly, and we've got to protect them. You know, that's all there is to it. You know, these people have given a lot. They've given so much wisdom. They've taught us, you know, they've crafted our lives. Please keep them in your prayers. Please, please do that. We can't let them be a number. Okay, thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. I want to follow up on what the governor said in really 3 different areas that I'll try to do relatively quickly in my comments. The first one is that Dr. Fauci predicted about 3 weeks ago that we would see 100,000 cases of COVID in a day in this country by the winter. Well, we've now seen 3 days of over 100,000 new cases, and yesterday set a record, as the governor reflected. We know that as we look at the types of approaches and strategies that we use to try to help advise the governor and help the great state of West Virginia and each citizen of this great state, that we know that when things get really tough and when we have to start to make decisions or make recommendations that will affect people's happiness and affect their lives in a variety of different ways, that it is really important to go back to what our real values are. And I think this goes back to our real values as a state. But I would say for me, polar north, true north, is saving lives and protecting the well-being of our citizens. And that has many ramifications and many dimensions. And the governor is the chief executive officer of our state and has been leading our state wonderfully through this pandemic. But as we start to look at issues about sports and schools and businesses and look at what's happening around the country, look at what's happening in West Virginia. We've just gone over the 3% cumulative rate. We know that we had an all-time high for the number of positive cases. We know that we are attempting to test much more, but perhaps in some communities, people are afraid of that or can't reach the testing. So we need to learn more what we can do to continue to save lives and protect the well-being of every citizen. And as we look at the approaches that we have done, and I'm going to particularly just take a second to focus on the county alert map, the map that we also use for schools and other sort of assessments of each county's relationship with the severity of COVID spread in that county. What we recognize is that as counties continue to increase the number of cases and as the spread increases with COVID in these counties, that the way to solve the COVID problem and the way to solve the school opening issues and the way to solve the playing sports issues is come and get tested. We know that still a majority of people in West Virginia are not infected as opposed to those that are infected. And by testing more, we know that those numbers, that color will go down, the rate of spread will go down at the percent positive level. It absolutely will, but it does require the commitment of the community to come out and get tested. And by doing that, we also identify those small few people who can spread to many, many others, the so-called super spreaders. So that is one. Number two, though, the other way to affect the county map and the alert system in a positive way, and importantly, save lives and protect the well-being of each citizen in West Virginia, is wear your mask and stay physically distanced. Stay smart. Don't take off your mask indoors if you can help it. If you're at a restaurant or a bar or a coffee shop, try to take your beverage, if it's legal to do so, outside and stay separated from people. And remember that from the CDC, a meaningful contact now is 15 minutes cumulatively in a 24-hour period of time, 6 feet or less than other people. And we know that the spread is happening in community, in homes, in gatherings, in churches, and now in nursing homes, et cetera. The last comment I'd like to make is around the school safety, because I think this is really important. And again, our commitment is to try to get each child and each teacher and each staff back in school safely. And we know the biggest predictor of spread in schools is spread from the communities. But, and what I'd like to go through real briefly is an epidemiology report that Secretary Crouch will have posted after this press event. And this is done from data that is up to November 2nd. And just as a reminder, as we look at outbreaks in schools, and there was 69 outbreaks up until that time, the governor's reported we've had more. Remember, the process is we find an outbreak or a positive case in a school, the local health department works with the school very closely and tries to identify what are the appropriate mediation steps that need to be done. And as we look at all the outbreaks in the school up till November 2nd, this is from August to November 2nd, 69 outbreaks, a total of 249 confirmed cases from 36 counties. The range is 2 to 14 cases per outbreak. The median, which is in the middle, number is 3 cases in an outbreak. 104, 41.8% were students, and 104, 41.8 were students. 145, 58.2 are teachers. 29, which is 42% of the outbreaks, occurred in staff only. And this was a result of in-person meetings, congregating in break rooms, close contact among teachers, particularly those who co-teach. 12 of the outbreaks, 17.4%, occurred among sports teams, primarily football and volleyball. 11.6 outbreaks were a result of students or staff being in close contacts of a case or associated with outbreaks that occurred in a community source as opposed to an in-school source. 5 of the outbreaks, 7.2%, occurred on buses or non-sport extracurricular activities. And importantly, 10 of the outbreaks, so 10 of the outbreaks occurred in classes. My slides are messed up here, but 3 in special education settings where close contact is more common. 3 resulted in only a single student and teacher developing illness. 2 outbreaks occurred in a music or health settings where the classroom activities likely increased risk of transmission. 2 outbreaks in educational settings where there were multiple teachers in the classroom who were positive, increasing the risk of exposure. And we recommend, as the schools have taken up, to wear face coverings at all times when people are inside with each other, particularly in children that are able to mediate that, stay separated, have teachers and staff, be careful about congregation, particularly at shared times where masks are off. Be aware that community spread is still the most common, to bring that back to the school. And we've talked about separating the students in small cohorts and having consistent seating so that we know where people are. And it's really important that Dr. Amjad and I had a conversation with Emily Oster again today, who is running the project at Brown University that is starting to look at COVID spread in all the schools. And what Dr. Oster has found, as well as what other people have reported from around the world, is that young children, while they may be able to get the infection, to be able to be tested to show that they have the infection, are less likely to spread that to adults than older children are. And it turns out from Dr. Oster's preliminary work that it looks like high school age children can spread like adults, and elementary school children spread much less readily than that. And we see that also reflected in a recent CDC report that basically looked at 57,000, I believe, daycare workers, and found that the rate of spread in daycares is remarkably small. So as putting all this together, what we see is that West Virginia has still done well during this pandemic. The pandemic is accelerating. We are seeing that in West Virginia as well. And we need to focus on saving lives and protecting well-being of all of our vulnerable citizens and other citizens, working to keep schools in in-person education as much as we possibly can. And to do all those is we need to reduce the spread of COVID-19 in our communities by testing, by wearing masks, by staying physically distanced, by paying attention, avoiding those 3 C's that we've talked about, and showing the country what we can do when we do this together. And that has been the secret to our success so far. So thank you for all the people in West Virginia, and certainly all of our National Guard colleagues, our DHR colleagues, who are working nonstop on our behalf. And thank you to the governor and the leadership of our state for being able to make these very difficult decisions in a way that does focus on protecting well-being and saving lives.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. National Guard personnel are in 22 counties with 48 test lanes, 100 personnel supporting local health departments, DHHR, and other personnel doing testing in our immediate need counties. In addition to that, National Guard personnel and DHHR personnel are supporting 29 of our local health departments with direct support for contact tracing and case investigation. Over the next several days, we're going to continue to work exceptionally hard to meet the governor's intent on testing by working to roll out more steady state facilities within our county. So, for example, additional pharmacies, additional clinics, additional primary care sites, all those places that we can make more easy access to testing available. So you will see more about those sites in the coming days as we continue to build that steady state testing capability that the governor has directed us to do. Thank you.
Thank you, General. Bill Grouch, Secretary of the West Virginia DHHR, and Dr. Ayne Amjad, our State Health Officer, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, facing what's going on here with the spike and more red counties, I know that you and Dr. Marsh and all of the panel tell us at least 3 times a week, here's what we need to do. I participated in Governor DeWine's briefing in Ohio yesterday. They had record number of cases facing some similar problems. So there's a question I would ask you, and I'll try to ask of him as well. While you said everything is on the table and you're doing whatever you can to fight and combat the problem, you've also said you trust West Virginians to do the right thing, to make the right choices. Well, apparently that's not working out. It reminds me of what my mom told me. You talk about your dad's sayings. My mom said, you know, you can wish in one hand and fill the other one up with mud and see which one gets heavier faster. So while we hope West Virginians will do the right thing, when is the time to think outside of the box and get outside of the press conferences and maybe move people onto the ground, to the stores, to communities, to neighborhoods, to talk to people one-on-one, National Guard troops, DHHR employees, day hires through CARES Act money, where you can go to these centers where you see people aren't wearing masks and you can encourage them personally on the importance of doing it, the dangers of small group gatherings, the holidays and the hazards they present. When do we start thinking more innovative than even what you've done so far? If you say everything's on the table, how about getting people onto the streets and seeing if that may have some impact? Thank you.
Well, Kenny, my answer to that would be just this. We want to continue to be able to think outside the box, come up with better ways. Without any question, there's been a very, very high percentage of West Virginians that have really listened and really done exactly the very, very best to follow the guidelines. And there's no question there's situations to where it could be a lot better. But if you'll just look at West Virginia compared to Ohio or Pennsylvania or Kentucky or Virginia or wherever it may be, and look at the results and think just for a second that West Virginia is the most vulnerable of them all, it's hard to argue that the math would show you that really and truly things have been great. But we know and we see situations like you're talking about. Now, General Hoyer is working on some additional things that he's going to come out with and additional announcements real soon. But Kenny, at the end of the day, really and truly, putting people out there on the streets, and we're doing some additional, we've now contacted the, Coach Brown, Coach Huggins, they're going to do a commercial infomercial for us. We've contacted Coach D'Antoni and Coach Holliday. They're going to do one. Coach Pruitt and Coach Nealon, they're going to do one. All the effort is going to be saying the same thing that Dr. Marsh says over and over about wearing your mask and everything. It's just, Kenny, everybody is doing everything that we can possibly think of. And from the standpoint of going out there and talking to the people and everything, sure. I mean, I think that would be great. But the problem with that, Kenny, is real simple. You go out there and you get a bunch of people together, and bingo, you cause yourself more of a problem. So that's why everybody's trying to do stuff virtually as best we possibly can, and so we continue to try to think outside the box. Any idea is welcomed, and we know West Virginians have done really, really, really good, but we know we can be better too, lots better.
All right, thank you, Kenny. Next to Taylor Stuck with the Herald-Dispatch.
Hey everyone, it's Taylor. With spread of the virus high in our communities, I was wondering, how are our universities overall doing in controlling spread, particularly after this past Halloween weekend?
I think Dr. Marsh, one of you guys are going to have to answer that. You'll be better at that than I will.
Well, thank you, Governor, and thank you, Taylor. That's a good question. I can speak more confidently about West Virginia University because I'm connected with that university. But I think that to date, the universities in the state, and particularly, again, I have more primary knowledge of West Virginia University, has done well so far. As you remember, the WVU took a break about 2 weeks into the repatriation of the students back to the campus and back to Morgantown, because we saw an increase in the number of cases in that 20 to 29-year-old, really 18 to 29-year-old group. And the governor then worked to shut down the bars at that point, which helped, and we reduced the density of contacts on the campus by going completely online for 2 weeks. And that seemed to be really important. But so far, I think we have done well as a state in the universities. There was a small study between the School of Public Health at West Virginia University and the Centers for Disease Control that looked at mask wearing. And they did this in a scientific manner and found that there was about 85% consistency of mask wearing on campus. And I think that this really goes back to that idea that in school, if things are done correctly under the right guidance, then school is generally very safe in the classroom. And that's what I tried to reflect in the epidemiology report that was prepared by the Bureau of Public Health, our epidemiology folks, which we appreciate greatly. But also to point out that many of the cases that we had seen at the university, at WVU, and also at other universities, both in West Virginia and around the country, really came from community-based socialization events where people weren't careful, where people weren't wearing masks, where people were engaging with each other at very close confines in bigger groups, crowds. And that's where we saw the majority of the spread. So I think that at the universities, all of our universities are doing well, but we have to be very careful because we've seen the increase in the number of cases in that younger age group come back again. We had sort of seen it move to an older group, and now it's very evenly distributed across all age groups, including that 20 to 29-year-old group, which does reflect students and younger people. So that's something we'll keep a very close eye on.
All right.
Just 1 second, but all I'd want to say is this, from our colleges or universities or whatever, the HEPC, the higher ed group, they're working this. We're doing random testing. For the most part, it's pretty good. I mean, really, it may very well need, that if there's a need for some additional funds or resources from the governor's side and everything, we're standing ready to help anyway. But for the most part, it's pretty good.
All right, thank you, Taylor. Next to Charles Young with the WV News.
Hi, this is Charles Young with WV News. Governor, on Wednesday when I asked about the cumulative rate getting close to 3, you said that was not a line in the sand. Now we've gone past that point. Looks like a lot of our other indicators are getting worse. What is the line in the sand? I mean, if things are bad and they're only going to get worse, I guess I'm wondering, what are we waiting on to take these things from being on the table to being active measures? Thank you.
Well, Charles, the line is saying, I'm going to let some other people, chime in on this. I think Secretary Crouch, if you could, that'd be good for you to talk about this a little bit. But Charles, let me just say just this, from the standpoint of all the states that are around us, from the standpoint of what's going on within our nation, from the standpoint of going to school, not going to school, from the standpoint of closing bars, not closing bars, whatever it may be, I am telling you, everybody right now is on super high alert. Our number of 3% that we came up with a long time ago, there's lots of stuff that has changed since that point in time. And this shouldn't be a line in the sand that says, this is what we're going to do. If we cross this, we're going to shut down the whole universe and everything. But I can tell you, Charles, that everybody's awfully concerned. I go back to those kids. Kids that are on, whatever it may be, a cheering team or a volleyball team, that truly, could all be tested, and then they could all go and compete. And then the first thing that's going to happen is parents and or fans that would show up in there, and then all of a sudden, before you know it, we've got a real problem on our hands. And that could very well happen and everything. So with that and everything, if we're going to make the toughest decisions in the world, that basically the most innocent, those kids, can't end up playing or can't end up going to school, then absolutely we've got to understand that we are on a heightened alert, and really and truly we've got to be willing to continue. If we continue on this trajectory, then we're going to reach a point in time where we're going to have to pull back the reins on some things and some additional things. So Secretary Krause, maybe you could just add a little bit more to that, but Charles, we're not right there yet, but it's sure getting closer.
Yes, Governor, thank you. Thank you, Charles. That's a good question. This positivity rate is another example of how things have changed since we started fighting and battling this disease. Back in March and April, we were looking at that hard in terms of are we going to reach that target? And we did that. We went over that target back in that period for some time. And then we modified our approach. And we've said all along that we have to learn more about this disease as we go forward. And we have to change our approach to the disease based upon what we've learned. So if you'll recall, and we've talked about this many times, we were focused on looking at the infection rate, the incidence rates in counties for several months. As we moved forward with that process, the positivity rate was not viewed very much or talked about very much. As we learned that the incentive to test was less, looking at just the infection rate, we realized we had to change the system again, and we looked at the positivity rate to get people to test. So that's what we want. So as we test to find more individuals in the counties and in our communities that are positive, whether they're symptomatic or asymptomatic, we want to find those individuals and reduce the spread in the communities. As we do that, the positivity rate is going to go up. That's not necessarily a bad thing any longer in terms of making sure that we are moving out into the communities with the testing so that we identify those individuals. So that 3% that we talked about early on is not a target to create change or to make decisions that we don't need to make just because we've hit a target that is now in the past. So we will change as we go forward again. This disease is continuing to grow in the state, and we've got to find better ways to combat that. The ways to combat the disease are to test and to wear masks. Everyone needs to remember you're a host. You're what the disease is looking for. You're an individual out there that is susceptible to transmission of the disease. Once that disease is transmitted to you, the disease is looking for other individuals. So please be safe, wear a mask, test. Everyone in West Virginia needs to test for the benefit of their communities. Thank you.
All right, thank you, Charles. Next to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Kind of talking about thinking outside the box. Are we thinking about trying to find new ways of testing or more partnerships with say pharmacies, or what we were doing with Walgreens and Fruth? Because I mean, looking at the numbers, and you're right, I mean, particularly in smaller counties, rural counties, you're looking at situations where there just aren't that many people coming out to test, whether that's because the hours are bad or whether that's because people are reluctant to do it. I don't know, but you are seeing some small numbers, and I'm also hearing a little bit about some burnout with county health departments, with some of the DHHR workers that are helping to try to plan these sort of things, and it's getting more difficult to do, especially when you have such a small turnout in some of these counties. So is there a better way to kind of expend resources in order to maybe maximize testing in a way that doesn't cause burnout? Thank you.
You know, I think Clay, you start. You know, there was some stuff in there regarding to you know, new ways of testing and all that you would know better than I or Dr. Amjad. You start out, and then I'll end up with this one.
And also, Governor, we may invite General Hoyer to make some comments as well if he would like to. But thank you. We are really trying to move to the kind of testing that is more immediately available as far as the results, and also requires much less infrastructure to be able to gain access to the test. So part of where we are going is to look at ways that, as we've seen in other states as well, where we might be able to instruct people to self-administer some of the testing that we currently require personnel to do. We are looking at expanding our capability around sputum or saliva-based testing, which can be done under observation and eventually can be done even at home. We are looking at antigen-based testing and how that fits in, which is basically looking for the proteins on the virus itself, as opposed to looking for the genetic material, which can give results back very, very quickly. And we're also looking at developing additional capabilities and resources at our universities to be able to look at pooled samples of testing, where we might be able to look at multiple people all at once, say 10 people per well in a 96 well plate, which would allow us to expand our testing capacity by 10 times. And if we found one of those pooled samples to test positive, then we would separate each person in that pooled sample and try to identify which person or which people in that sample tested positive. So we're looking at that, expanding our assessing prospective assessment of where the more COVID activity may be with more wastewater testing. So there's a whole bunch of new avenues that we're looking toward, both avenues that we are creating ourselves, but also avenues where we can partner more effectively and deliver results quicker, cheaper, with much less infrastructure involved. And I'll defer to Dr. Amjad, to you, Governor, and or to Major General Hoyer.
Thanks, Steve. I'll add a few things, then I'll let General Hoyer speak. But so in addition to having the tools to test differently and out of the box, we're also reaching out to several people in the state to help us have people turn out for these testing events. For example, we reached out to the different food banks because they're already out there providing food for people. So we want to be available during those same times as well. So they're going to partner up with us. So that's one avenue. We had a big meeting with the West Virginia State Medical Association last night and several other medical communities to get on the same page with prevention and medical care for patients in the state so that people know that COVID-19 should be a differential diagnosis getting into the flu season for patients. So that's one avenue. We've had multiple meetings with our church communities in the state, with different faith-based leaders throughout the state so that we can give them the opportunities to have the saliva kits available. So not only to test in their parking lots, but to give them the actual kits to use in their communities. So we've been doing these things for the past several weeks so that we have not only the kits, the testing lanes, but also the people, and have them comfortable to do these things within their reach, actually. So now I'll let General Hoyer speak more to that as well.
So Stephen, you bring up a good point. To meet the governor's intent of broad-based testing to address and mitigate the spread, we had, as part of the strategy we built with him, we had to put a surge capacity in place with guard assets, local health departments, and that's what you're seeing right now. That's giving us and buying us the time to build those steady state capabilities, like you mentioned with Walgreens, Fruth. We're working right now with CVS. A good example too are independent pharmacies, Hurley's Pharmacy in Williamson in Mingo County, which needs the testing capacity, is coming on Monday. So building that steady state piece is what is in progress, but right now what you're seeing is that surge capacity that we had to put in place to meet the governor's intent.
Okay, Jordan, can you come back to me? You know, Stephen, part of your question was, you know, as far as looking at potential burnout of the health department or whomever it may be, you know, about people showing up, wanting to do tests and everything, or working at it, and maybe the people not coming out. Now, I want everybody really to dial in just for a second, because I can't say anything more profound and more blunt. And everybody that knows me knows that I'm going to tell you the truth. And I'm going to tell you just like West Virginians tell you, you know, just straight up. Now just think about this just a second. The bottom line is, what if tomorrow we just decided the best thing to do is just not test any significant, with any significance of magnitude greater than where we are, who knows when. What happens? Well, if we don't test, we're going to have more and more and more people die. And not only that, we're going to have more and more and more counties go orange and red, and more schools close, and on and on and on. Guarantee it without any doubt. Because when we test, we are finding people that don't have a clue that they even have this, and it's causing good things to happen. Now, that's for absolute certain. If we slack up on the testing, we are absolutely going to blow ourselves out of the water as far as deaths, not going to school, not playing ball, and then leading us to more stringent things like shutting down whatever it may be. For sure. So we sit here every day and encourage you to come out and get tested. And then we have counties that are calling saying, you know, my gracious sakes alive, you know, what are we going to do? We're getting ready to go into playoffs or the cheering competition or whatever it may be. And why can't we go? Why can't we go? And everything. Now just think about this just a second, because I want to read this to you, and I want you to get this. Now, Brian, you got to turn your phone back on. You know, but I just got this, and this is really important. I want you to stay with me just 1 second. On November the 2nd, in Wyoming County, we had 26 people that show up, and we had one site in Wyoming County that no people came. So we set up a testing site, and not one person shows up in one site. In Wetzel County, and Tyler together, we have 47. In Mineral, 63. In Jackson County, we had 10 people show up. I'm not going to mention Berkeley at this time because they did really good. They had 471. I will mention it. Jefferson had 60. In Fayetteville, we had 74. That's good. Wood County, we had 306. Wayne County, we had 82 this day. Morgan, we had 17. Upshur, 8. Logan, 19. Hampshire, 31. In Ritchie County, we had a site where nobody showed up. And in Mingo County, we had a site where nobody showed up. We had 10 total in Ritchie County, 18 total in Mingo County, and 17 total in Monroe County. So just stay with me. Stay with me. The very next day, in 20 counties, we had 43 in Ohio County. Imagine, 43 in Ohio County. We had 238 in Berkeley County, good there. We had 17 in Ritchie County and another site where nobody showed up in Ritchie County. We had 71 in Marshall, 53 in Wyoming, 37 in Tyler, 37 in Logan. Mineral did great, 217. Wayne had 70, which was good. Wetzel had 46. Morgan County had 10 people show up. Jefferson County had 31 people show up. Wood County, 146. Mingo County this day, 4. Monroe County, 12. Lincoln County, 4. Hampshire County, 5. Upshur County, 53. Jackson, 38. And Braxton, 13. Now let's just, I could just go. You know, I directed our great general of our National Guard to triple testing. I directed him and said, pour the money to it. Let's get out there and test our people. Now, when you have an entire county, especially a county where, you're worried about going to school or playing ball or whatever like that, and 0 show up, or you have an entire county and 10 show up, or you have a gigantic county and population and have 35 show up, really and truly, are you being really fair? Are you being fair to absolutely not show up and then absolutely, all of us just be mortified about what's happening? We're all concerned. We're all doing everything within our power. There are people that are getting burned out because they're being worked and tasked to the nth degree. On and on and on. There are people getting worn out, and you've got to show up. And when you don't, all you do is just make them more tired and more confused, more wondering what in the world are we doing and everything else. But if we're willing to put the resources, and I'm willing to tell our great general, I don't care. I don't care what you're doing. Triple what you're doing. Some way, somehow, find another gear. And then we don't show up. Now, the facts are just as simple as just that. Some places we get it, and some places we're not, and some places where we're not, then we complain. And really and truly, just to tell it like it is, West Virginians, you've always respected me from the standpoint of me just telling it like it is. We got to show up, and we're not doing it. Now, so Stephen, it's a long answer to your question, but your question, the reality is, we are getting people burned out, and the recourse is this. And I let off by saying it, and please, West Virginia, listen. The recourse is just this. We are getting people burned out. People are not showing up, so okay, let's just don't test as much. The very second we do that, West Virginians, you mark it down. Jim Justice is telling you just as mark it down can be. We will have way more people die, and we will have many, many, many more counties shut down as far as school and as far as our ball team, abilities. It will shut down, shut down, shut down. Now, West Virginia, if you don't test, that's what's going to happen. If we pull back because people are burned out and can't test, that's what's going to happen. Ball's in your court, West Virginia. You got to show up. I just got tested again just a few minutes ago because we had some level of exposure here at the Capitol, and all my staff's getting tested again. Absolutely, West Virginia, you got to show up. That's all there is to it.
All right, thank you, Stephen. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I wanted to ask a question about how much you look outside of state lines for what may be coming to West Virginia. I know you did look at it coming up from Kentucky into the southern part of the state back in the summer. In our area, Mineral County has gone red. I could see that coming because right across the river in Allegheny County, well, the last 2 days we had 90 cases in a 70,000 population county. The week before, every other day we were getting reports of 30 to 50 people testing positive. You could see that headed toward Mineral County and also Hampshire County. Is there a regional approach that could be taken that may help head off some of this?
And was that Paul? Is that correct? Paul, I'll be real quick. I'll tell you this from my standpoint. I'm checking all across our country all the time. You heard me, on this thing coming from Kentucky. You heard me from the standpoint of this thing coming from the South. You've heard me from the standpoint of the flu season and this thing coming with the fall. You hear me talking about it all across the country. You heard me probably just last Wednesday or Monday, I can't recall, talking about the docs that I was talking with at Johns Hopkins about what's going on there, what's going on in Maryland and everything. Everybody's trying to predict, all across this land, all across the globe. Everybody's trying to come up with some level of prediction that gives us a heads up, a little bit of advanced warning. But, Paul, I really think that the advanced warning is just this simple. It's the flu season. More people are going inside. Probably people are getting tired to some degree, and this thing is catching us. And so, Dr. Marsh or General Hoyer, you may want to add all the different things that you do and watching what's going on around us. But I think at the end of the day, we're all plenty smart enough to know that we got a problem. It's still here. It'll be here until we get a pandemic, until we get a vaccine, and so we're just going to have to buckle up. That's all there is to it. Dr. Marsh or General Hoyer, if you got anything, please add it.
I'll just follow up on the governor's point. We track daily between DHHR and the National Guard the surrounding states, the infection rates and the percentages in the surrounding states, and particularly the counties bordering the state of West Virginia, to do exactly what the governor said, is to look at not just in our region, but across the country, and we can see things that are occurring to continue to try to mitigate the threat going forward.
And if I could just make one quick comment, Paul, I think that that we're in a different time right now than we have been. And for a lot of people, that may not be as apparent as it is for all of us. But COVID now is spread everywhere. It's not in New York or Texas or Florida. It is everywhere. The two highest states for hospitalizations in this country that have set records are North Dakota and Wisconsin. And so as we look at adjacent states and counties, as you're talking about, with Ohio and as the governor's talked about with Kentucky, et cetera, we do see much more activity in these states than we have before. But it is at this point incumbent upon all of us, and particularly us in West Virginia, to protect ourselves and use the power that we have. As the governor has pointed out so clearly, test. It's the cornerstone of what we do. Then we have to contact trace, and we need people to participate, to cooperate with us so we can figure out who has been connected to who. But the single important thing that we have to do to reduce the spread, to give us what will be the same impact on the reproduction value, the spread, as a vaccine, is wear masks and physically distance. Wear masks and physically distance. And if we do that effectively, with greater than 80% cooperation and agreement in the environments that when we go inside or when we're around each other with people we don't live with, we will start to drop the rate of spread in this state. That right now, I believe only one state in the country has a reproduction value less than 1, meaning only in one state is the spread slowing down, and every other state in the country it's speeding up.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi. As we've said, the pandemic is accelerating, but there's this apparent consternation over sports and the maps. I guess some teams can play, some teams can't play. It changes from week to week. It's not fair. Would a possible answer be to just shut down all the sports? That's a sledgehammer, of course, but it's completely fair, and everyone would have to shoulder that burden equally. Thanks.
David, let me answer that, okay? And let me just say just this, from the standpoint of, I told our people yesterday, or day before yesterday, I'm sorry. I just went through just this exercise. I said, what if we did this? What if we just eliminated the state playoffs and we just allowed people in counties to continue to play games when you were in a situation of color that you could play games? And we basically extended the season for everybody to be able to maybe get more of their games in. What if we just eliminate the sports period? What if we have an outbreak of the bar situation in Mon County and we just eliminate the bars statewide? David, it is a very, very, very difficult situation. And in all honesty, what we're trying to do is to try to keep some resemblance of what we do as people going. I commend the education community and the medical community, the SSAC. They're trying with all in them to keep going to some point. I get it. I really get it. How you have a situation, whether it be one of these counties where nobody hardly showed up to get tested, and all of a sudden, their team is ineligible, and those poor kids they're innocent victims. I get it. I get it wholeheartedly. And I have no clue why their coaches, their administrators, the teachers, the media in those counties is not encouraging people like crazy to come out and get tested, because when none show up, or 4 show up, or 10 show up in an entire county to be tested, and then the ramification falls right in the lap of these kids, it's just tough. It is just plain not fair in lots of ways. So David, we've talked and talked and talked. I've read to you the recommendation of everybody, and everybody's trying to do the best they can possibly do. And I I have been open to many different variations of everything from just not having playoffs to whatever it may be. But all I can do is be very respectful and thank all the people that are trying to do the best they can possibly do for the whole, and there's specifics along the way that it's affecting in a very negative way, and I hate it. But I think they're doing the best that they can do.
All right, thank you, David. Next to Junaid Dill with the AP.
Hi, Governor. Thanks. I'd like to ask a bit more about the possible exposure you mentioned at the Capitol. Was this someone working at the Capitol, and was it someone in your staff? And when did that become known, and how many people are getting tested? Thanks.
It's someone, it's someone that they're not on our staff. They're working at the Capitol, and I think it's fair to say that what we're doing is in an abundance of caution. I believe that, and don't hold me to this specifically, but I believe that they were associated with the Attorney General's staff or the Attorney General. I'm not really sure.
All right, thank you. Next to Katie Coyne with the Charleston Gazette-Mail.
Hi, Governor. Switching gears a little bit, with the CARES Act money for utility bills, why are the dates on that only set between March and July when data shows that thousands more lost jobs after that time and are probably behind in bills? And why limit it to $25 million when PSDs themselves are saying that's not enough to cover what they're owed and keep functioning?
Okay, I don't know why, but I'm not hearing exactly all the question, but from the standpoint of the 25 million that we put into to helping people with their utility bills and so on like that, that was the number that through working through a lot of different math, that we came up with and everything in order to be able to just try to help. But Mike Hall, my chief of staff, he was the person that brought us that number and brought us that from a standpoint of accumulation of a lot of mathematics that he had put together and everything. But we're just trying to help as much as we can, help with the dollars that we do have, in as many areas as we can possibly help. But I hope that answers your question.
All right, thank you, Katie. Next question and last question today comes from Mark Curtis with the Next Star Media.
Good afternoon, Governor and cabinet members. The election is over. Governor, your friend President Trump may not have won. We don't know yet, but in the Congress is reconfigured. Some folks are talking about waiting to January when the new Congress is sworn in and the new president is maybe sworn in to do an additional CARES Act. Would you rather urge them to go back now in a lame duck session and get this done in the next week or so?
Mark, I sure would, brother. I mean, that's all there is to it. I think that, I hate to say this, but it has been my recommendation, and that I have had with the president and all of his people through the time building up to the election. My feelings were really just as straight and simple as simple could be. I felt like that we needed to move forward from a nation standpoint to be able, because we've got people, whether they be in the restaurant business or whatever it may be, that are out there suffering like crazy, and you've got people on top of that have lost their job to no fault of their own and everything, and they're suffering like crazy. And absolutely, from the clarification of where we are, within the state of West Virginia, as far as additional guidelines or additional stimulus or whatever it may be, we're trying to divvy up the money, just like was just asked a second ago about people and their utility bills. And Katie, I want to follow up and just say one last thing in regard to that. We're working off of recommendations from the PSC. I mean, as far as they have given us numbers, and of what they think. And so So there's, you know, Mark, I would urge in every way, irregardless of who is going to become the president, absolutely, I would urge in every way for us to get back in some way, somehow get that stimulus package out and passed, because we got a lot of people that are still hurting across this nation. West Virginia is not hurting nearly as bad as many states, but really when it boils right down to it, we absolutely have got a ton of people that we could be helping, and I can't tell you how, you know, you know me, I just always tell it like it is. I think it was silly and political and so many things not good that caused that to hang up and continually hang up and not get done. And we have a lot of people that are they're just hanging on, and in fact we've got thousands and tens of thousands of businesses across this land that are going belly up that will not recover, and we dink around with politics and don't get it done. It's just not good with me.
All right, thank you, Mark. Governor, I'll turn it back to you.
The only other thing I'll add is just this, and this is kind of a little bit of a follow-up with Mark, but we're going to continue to manage our finances in this state to the very, very, very best of our abilities. We have done so. Absolutely, our state is doing great from the economic aspect, and we can absolutely just continue to keep on the pathway of doing the right things and managing it properly, and it'll just go better and better. If the stimulus package comes, an additional stimulus package comes, it's only going to make things better. You know, if we pass a federal infrastructure package at some point in time, it'll only make things better for West Virginia. West Virginians, you are really teed up to go right now, and we just don't need to, you know, blow our legs off and do something really stupid, and you know, with our dollars, and we need to manage them properly, and we're doing so, and so we'll continue to do that. I urge you over and over and over to go and get tested, and you know, I want to say this to our media friends and everything. You know, we could be sitting here talking about, you know, the election. Well, Governor, how do you feel about, you know, your reelection, or what's going to be the next thing you do, or this and that and everything else, and basically somewhat ignore the concerns of the COVID situation. But our media friends chose not to do that. You know, they understand how serious this situation is. So I commend them for their questions, you know, for Mark's question about the CARES money, you know, the additional stimulus, package, to all the different things, all the questions that have come up all day, and everybody concerned. You see, that's, to me, everybody pulling this rope together. So thank you, you know, to all the press out there and all the questions today, because we stayed really, really dialed into COVID, and a concern that we should genuinely be very concerned about. So thanks again to everybody out there, and we're just going to keep at it. We can all pull the rope together. We're going to get through this. Thank you again.